Hi everybody, it's Bobby Pratt with the Great Lakes Surf Rescue Project. The month of May is National Water Safety Month in the United States, and every day this month we're talking water safety. Today is the 5th of May, Cinco de Mayo, and we're talking about drowning CPR. Yesterday, we talked about the timeline of drowning and how important it was to get to victims as soon as possible. It's also very important that we begin resuscitative measures on people who don't have a pulse or are not breathing in a timely manner. If we can get to people within the first 2 minutes, we have a 94% chance of survival if we do resuscitative measures. As every minute that goes by is about 10%. As we learned yesterday, the drowning process doesn't stop until we provide oxygen to the brain. So we need to start with rescue breaths, and we need to continue rescue breaths and compressions for someone who's in cardiac arrest. So we're going to talk drowning CPR. CPR stands for cardiopulmonary resuscitation. Cardiopulmonary resuscitation was invented in the 1950s by two doctors, Dr. Peter Safar and James Elam. One was a cardiologist, one was a pulmonologist, and they realized how important both factors were in terms of resuscitation. In the 1960s, CPR became very common, and training for CPR was done by organizations like the American Red Cross and the American Heart Association. In the 1990s, they added public external defibrillators, AEDs, life-saving devices, fantastic devices. The AIDS epidemic made people reluctant to do CPR. They made people reluctant to even take CPR. In 2008, the Heart Association and the American Red Cross decided that they would support a program using hands-only CPR, using compression-only CPR. The idea here is that there's still oxygen in the lungs of a person having a heart attack, a sudden cardiac arrest, and all we need to do is push hard and push fast on the chest in order to move that oxygen up to the brain. This is a great idea. It saved thousands of lives, and compression-only CPR still is the treatment of choice for someone having a sudden cardiac emergency. But it's a cardiac emergency that requires hands-only CPR and not a respiratory emergency. When they developed compression-only CPR or hands-only CPR, it was met with tremendous media support, and there was a big media blitz, and unfortunately it was almost too good. One of the unintended consequences of this public relations program promoting compression-only CPR is that people believed, even some CPR instructors, even some medical personnel, believed that we were no longer doing rescue breaths in doing CPR. Unfortunately, this resulted in some really tragic events where sometimes people were getting appropriate CPR with rescue breaths and were told by bystanders or even medical professionals that they were doing it wrong, that they needed to only do compression-only CPR, and unfortunately people died. So while it was a very successful campaign to promote compression-only CPR, it had unintended consequences, and unfortunately drowning is different. If we look at Uncle Charlie here on the beach, Uncle Charlie has a heart attack and his heart stopped. He needs compression-only CPR. The problem with this situation is that the heart's not beating properly. There's still oxygen in the lungs, and we can move that oxygen around by using compression-only CPR. They need to have compressions on their chest, hard and fast, 100 beats a minute, to the tune of staying alive, or baby shark. And they need an AED. They need to have their heart shocked because it's not in an effective rhythm, and it needs to be shocked, and then the heart will reset its rhythm. If little Susie has a drowning, the problem is not with her heart. The problem is that she's used up all of the oxygen in her lungs. She's basically been suffocated by the water. So it's a brain problem. It's a problem of lack of oxygen to the brain. It's not a heart problem. We need to start with rescue breaths. Rescue breaths are effective in providing the oxygen into the lungs, and then we do compressions and we can move that oxygen around up to the brain. Sadly, there are still some medical professionals, there are still some CPR instructors who are unaware that what they're teaching is inappropriate. And in a lot of lay responder classes just for the general public, they don't even mention the exceptions to compression-only CPR, which are anything that's related to a respiratory insult. So drownings, suffocations, opiate overdoses, and children. Children in general have very healthy hearts. Children rarely have heart attacks. So it's recommended that if you find a child in cardiac arrest, you start with rescue breaths. The Red Cross has actually come out recently and stated that you should start with more than 2. You should start with 5 rescue breaths. The current training by the American Red Cross is 5 initial rescue breaths in a drowning situation or a situation that is respiratory in nature. If an old man like me has a heart attack, push hard and push fast on my chest, summon an AED. It's going to be a prolonged period of time before the ambulance gets there. Consider doing rescue breaths. I have a pocket mask in my vehicle. I have one in my paramedic bag. I have one in my swim bag. If you're not comfortable doing mouth-to-mouth on an individual, I completely understand that. But obviously, if it's the loved one, if it's grandma who's had a heart attack, or it's little Susie, your niece, or a child that has suffered a drowning, then it's very important that we provide that oxygen to them. Thanks. Have a great day.